السلام عليكم أحباء الطلبة. اليوم راح نتطرق أو نتكلم عن الجزء الثاني من محاضرة اليوم. موضوع Respiratory failure. This term شو وقت نقول هذا البيشنت عنده Respiratory failure أو failure of respiration. Patient normally this term is used when the pulmonary gas exchange fail to maintain the normal arterial blood gas اللي هي oxygen وال CO2 level in normal range. When the patient cannot get this gas in normal range, we call it having failure of respiration. So خلينا نرجع للاناتومي. نشوف هاي اليونت اوف respiration اللي our lung اللي هي alveoli and the surrounding arteriole. The blood comes from here our body having high tension of CO2 which pass to the alveoli and then pass outside, and then the O2 come from the outside to the alveoli to the RBC to carry to the tissue. So this is the ideal gas exchange in our lung. Any disease, any condition disrupt this process. Example, decreasing the blood flow by embolism, or decreasing in this RBC number, or damaging the wall, this layer between the alveoli and the arteriole, thickening in case of fibrosis, or damaging of the alveoli, or decrease in the gas exchange from on the outside, causing hypoxia, causing respiratory failure. So any condition affect this unit causing hypoxia, and causing respiratory failure. We classify this term into type 1 and type 2. These types, type 1 depending on the level of the CO2 level. Both type 1 and type 2 having hypoxia, but in the type 1 having hypoxia and having normal or hypocapnia. Capnia meaning level of CO2. So example of this disease, we have acute asthma, pulmonary embolism, pulmonary edema, pneumonia, pneumothorax, lobar collapse, and RDS, acute respiratory distress syndrome. The one point shared by this disease هو التكبنية. All patients with this disease having tachypnea and having rapid breathing causing washing of the CO2 by the respiration resulting in normal or hypocapnia. So in type 1 mostly occur in the patient acute illness, acute disease, acute condition causing tachypnea and causing hypoxia and hypocapnia. While in type 2 the patient also having hypoxia but having hypercapnia because of the chronic disease and causing disruption of the gas exchange, causing decrease in the CO2 excretion resulting in hypercapnia. Example, in patient with asthma which having type 1 and then when he get severe fatigue, severe illness can shift it to the type 2. Also in case of acute exacerbation of asthma, of COPD, also in the upper airway obstruction, also in the chest muscle paralysis or neuropathies like Guillain-Barré disease, or drugs interrupt with the respiration, narcotic drugs, flail chest injury, I guess RTA, or primary alveolar hypertension. All these causing type 2 failure by hypercapnia. After we know the types of failure, now how we assess the patient. Initially, or clinically, we assess the severity of the condition by checking this point. We should check the conscious level. If the patient confused or decreased conscious level, indicating the patient has severe illness. So we ask the patient if the patient respond to command, patient can cough, patient can communicate with the examiner or the other family member, and to see if the patient having impaired consciousness or not. Also, we search or we look for the CO2 retention sign. Any condition or any disease causing hypercapnia resulting in sign, we call it warm periphery, bounding pulse, flapping tremor, and even dilated vein in the hand, and also there will be optic disc edema by the fundoscope. All these are sign of CO2 retention in case of COPD. Also search for the airway obstruction, sign wheeze, prolonged expiration, hyperinflation in case of COPD, and intercostal drawing and burst lip. Intercostal drawing or يسموها مصطلح ثاني intercostal recession, which the inward movement of the intercostal muscle seen mostly in the children and in the thin patient during severe dyspnea and the patient having high negative pressure, so there will be suction of the intercostal space to the chest, causing intercostal recession, which indicate embarrassment of expiration. Burst lip, when the patient expire the air against closed lip, and this is mostly caused by the patient to try to maintain the intrabronchial pressure opened or dilated during expiration to get more improvement. And also we search for the cor pulmonale. This term we call it or we define as right ventricular dilatation or failure due to a chronic lung disease, which causing chronic hypoxia. Chronic hypoxia causing vasoconstriction of the pulmonary circulation, resulting in high pressure in the pulmonary circulation, resulting in backward effect on the right ventricle, causing right ventricular dilatation or failure. Sign, there will be peripheral edema, leg edema, there will be raised VB, there will be enlarged liver, and even ascites. We call it patient having cor pulmonale. There will be right-sided failure due to a chronic lung disease. And also search for the sign of the underlying condition like pneumonia, pneumonic fever, patient toxic, patient يكون cough, and so on. Investigation. How we investigate this patient? We send for the gas exchange to see the severity of hypoxia, hypercapnia, acidosis, and mercaptan level, and send for the X-ray to see the condition of the patient and lung condition of the patient. Management, roughly, there should be maintaining of the airway by the ABC of the CPR to see if the airway is opened, if there will be secretion, if there's any foreign body in underlying condition, patient يكون toxic, and physiotherapy sometimes used, and suction by sucker, and we can use nebulized bronchodilator, like beta agonist, which used freely in the ER, and also controlled oxygen therapy, starting with the 24% Venturi mask, which is useful in to giving constant oxygen to maintaining the oxygen level more than 90% or 7 kilopascal. Antibiotics can be used if there is infection, diuretics if there is evidence of the edema in case of cor pulmonale, and the progression of the condition if the patient after this high oxygen and bronchodilator and this therapy, and even can use steroid in some condition, in severe condition, and the patient has not improved, so patient still hypoxic and more hypercapnia and more confusion, so we should to the assist respiration by the ventilation support by the ventilator to maintain the oxygen level to the normal range to get the till the underlying condition have been improved or treated. Now we finish the next lecture, second part of our lecture. To see you in the next